The Republic of Mali, a landlocked democratic nation in West Africa, is the 7th largest country on the continent, the size of California and Texas combined. It lies within the 1040 window, an area where 90% of the people are unreached for Christ, and where Buddhism, Hinduism, and Islam are centered. In addition, this region contains 85% of the world's poorest of the poor.
The population of Mali is now nearly 16 million. 90% are Muslim, 9% adhere to traditional animistic beliefs, and fewer than 1% are evangelical Christians. Mali ranks 3rd among the poorest nations in the world, with incomes averaging less than $2 a day. A large percentage of the population is unemployed, and since a majority of the jobs are agricultural, chronic underemployment is common.
The typical Malian diet includes 3 major staples: millet, sorghum, and rice. After harvesting, the seeds are pounded to separate the grain from its husk, and the grain is further pounded into flour that is boiled in water to produce a smooth, pasty substance called tow. Tow is eaten plain or with a thin sauce of vegetables, supplemented on rare occasion with meat.
The climate in the southern Sahelian zone is generally hot and dry, with daytime temperatures ranging from the 80s in the winter to 110 degrees in the summer. The rainy season, when the vast majority of crops are grown, spans from June to September, with an annual rainfall of approximately 30 inches. The northern 2/3 of Mali lies in the Sahara Desert, where temperatures can soar to over 120 degrees.
Beginning in 2008, Carol and I have had the opportunity to serve at Koutiala Hospital for Women and Children in the south-central portion of the country. I've worked with Dr. Dan Nesselrode as well as several young Malian physicians, teaching them obstetrical and surgical skills.
During our first trip to Mali, the desperate need for dental care was obvious. Given my previous training and experience, I was only prepared to clean teeth and extract those that were beyond repair. Subsequently, I've had the opportunity to work with a missionary dentist to learn skills necessary to fill decayed teeth. These skills have enabled me to save many teeth that would have otherwise been lost.
Mali's health and development indicators rank among the worst in the world, with a life expectancy of only 49 years. Typhoid, tuberculosis, malaria, and HIV/AIDS are common, and high-quality healthcare facilities and well-trained physicians are few. Women and children are especially affected, as the society is strongly male-dominated, making Mali one of the worst places to be a mom or a baby.
Here in Mali, the cumulative maternal mortality is upwards of 10%, near 10%. So if you break those numbers down, basically each woman, every time she delivers, she's taking about a 1% risk of dying, and she has on average 8 or 9 babies. So when she rolls those dice across her lifetime, she's taking a roughly 10% chance of dying as a result of childbirth. To find numbers like that in America, you have to go back to the American Civil War. Infant mortality is just as bad or worse. One in every 4 kids that's born live, dies before age 5. That's the official statistics. In reality, what we're seeing around here seems to be significantly worse than that. Initially, we thought, man, if we can just pull off 1950s medicine, if we can just do a safe C-section, if we can just transfuse and give antibiotics, we ought to be able to do something. That ought to be able to change something. And then in reality, if you look behind me here, what God's given us is 1990s medicine. He's given us some stuff that's just one generation off what we're using in America, and it's just the kindness of the Lord.
Fluid clear? A little bit of meth. Okay, sweetie pie. Yeah. Oh, sweet. Pardon me. You're good. You're good.
From before I even came to Mali, I have believed that the best place to reach women for Christ is in a hospital setting. In a clinic setting, they come and they go, you see them, they hear the gospel, and they go back home, and you may see them again and you may not. So they've heard and you're spreading the gospel, but they don't really hear it enough for you to really realize whether or not they're responding to it. Whereas in a hospital setting, you have them here, they're 2 or 3 days here, a week here, 10 days here, much more opportunity to speak to them about the gospel, to pray with them.
God has blessed us with expanded facilities at the hospital, and in January 2012, we moved into 2 new buildings, one for inpatient care and the other housing an emergency room, a recovery room, an intensive care unit, 3 operating rooms, and a labor and delivery suite that can accommodate 8 women in labor.
I was also blessed when the former maternity building was converted into a fully equipped dental facility, the Dan Hines Memorial Dental Clinic. Not surprisingly, the community has been excited by this new opportunity for health care.
Evangelism via patient care is clearly our primary reason for being at Hôpital Femmes et Enfants. If we focus on saving lives without introducing our patients to the saving grace of our Lord Jesus Christ, we've only accomplished a small part of what we're here for, of what God has us here for.
We're also committed to training Molly and personnel to carry on with this work when we are gone. I am now in the process of training a dental assistant who I would like to see go on to dental school.
And I am helping to train young Christian Malian physicians who will impact their country medically and spiritually. In the near future, we hope to have a formal OBGYN training program with the Pan-African Academy of Christian Surgeons and are working diligently towards that goal.
God has convinced us that He's in this thing. When we see a need and when we feel the pain of that He feels that infinitely worse, and He's looking for people to participate with Him. If we just give to God what it is we have in our hands, the miracle always belongs to God. It's never what we have in our hands. It's never enough to do what He's trying to do. It's not even close. The miracle always belongs to God, but He uses us when we just simply give Him what we have.
God does use us when we give Him what we have, when we make ourselves available for His service and follow His will for our lives. May God bless you for your willingness to partner with us and Him in this mission to expand God's kingdom in Africa.